Hey everyone, Aaron from Therapeutic Denver here. I'm here with Anjali, our office manager, and we're going to talk a little bit about functional dry needling today. So functional dry needling is a big part of our practice. We use it in the same way that we use soft tissue mobilization, joint mobilization, and that's a way to help decrease pain and improve range of motion. So what we're going to go through here is try to see what we can do for an assessment and a reassessment after the dry needling and see if we can get an improvement in function. So a big part of what we use functional dry needling for is trying to restore function. So what we'll do is we'll check Anjali's range of motion first and see what her limitations are, and that'll give us a better idea of where to insert the needles and move forward with our examination. So I'll have you look over to the left as far as you can comfortably. Good, looks pretty good to the left, and then over to the right. It's a little stiffer to the right. Challenges with that? Tough going to the right? Okay, gotcha. So then what we'll do is through the assessment portion, we'll go through and palpate to find some of those top bands in the muscle and determine where we need to put the needle. So one of the main components of dry needling is trying to find what we call trigger points. Trigger points are basically top bands of skeletal muscle that contract together, what you would kind of refer to as a knot. So the technique behind dry needling is to determine that location where you have that sensitivity or those trigger points, and that's actually where we'll insert the needle. Once we insert the needle, there are some chemical changes that occur that help to decrease pain and get that knot to basically relax. Try to get that to almost like we're hitting the reset button. So what we'll do here with Anjali is we'll find that trigger point that she's been having from sitting at our desk working. So we'll locate that top band of muscle using our neuroanatomy skills and palpation skills. We'll pinch that muscle, and then a little tap provides that needle into the skin. And that slow up and down movement, what we call pistoning, can help to stimulate a twitch response. So what that twitch response is a small muscle contraction that basically helps to pump out some of those chemicals that stick around when pain has been present in an area for a long period of time. So after we perform dry needling, it's really important to reassess to make sure that we affected the area that was causing some of that limitations in motion or causing pain. So we're gonna have Anjali retest that rotation. So we'll have you look over to the left, still looks good, and then over to the right. And look at that, a little increase in range of motion. So what that tells us is that we've affected that muscle. Hopefully we've changed the tone of that muscle. That trigger point is starting to decrease. So the important part, and that's where the rest of the physical therapy component comes in, is providing her with some sort of restorative exercise to offload that area that's continually getting stressed and to build strength in the support systems to try to, again, reduce that pain and improve function.